I think we're gonna get started. Okay. Well, good afternoon, everyone. My name is Carrie Shannard-Kunders. I am the Executive Director of South Dakota Board of Pharmacy, and I chair NASCSA's Education Committee. I'll be hosting this afternoon's webinar along with NASCSA's Kathy Keogh. Hopefully you've read the scrolling information while waiting for the webinar to start. It has information on our sponsors, NASCSA disclaimer, housekeeping items, and announcements. Today's webinars and all of our webinars throughout the year would not be possible without the generous support of our sponsors. So thank you to our sponsors. And thank you for taking time out of your busy day to join us for today's webinar, Drug Supply Chain Security Act. Are you ready? We hope everyone is, because this will start in November. NASCSA goes into effect in November of this year unless it's delayed, and we know there have been letters sent writing to request delays. And this webinar will feature a live demo of NABP's Pulse system. So we're thrilled to have my colleague and friend, Josh Bolin, presenting today. Josh serves as the Associate Executive Director for Government Affairs and Innovation for NABP, or National Association of Boards of Pharmacy. In his current capacity, he is the association's primary liaison with federal government agencies and Congress, and directs strategic initiatives and partnerships Josh is currently working with NABP member boards of pharmacy on uniform processes and tools with respect to the NASCSA. Since joining NABP in 2005, Josh has worked on development of PMP Interconnect, multiple pharmacy accreditation and inspection programs, including accreditation programs for DME and specialty pharmacy, and inspection programs for prescription drug supply chain, sterile and non-sterile compounding, and nuclear pharmacy. Josh also worked with NABP's member boards of pharmacy to develop standards for exchange and sharing of licensure and disciplinary data, NABP's Universal Inspection Form, and Multi-State Inspection Blueprint, which are all tools that are used to assist the boards of pharmacy in sharing data and conducting inspections in a uniform manner. This should be super interesting to all of us as we see this sea change in tracking and tracing products through the supply chain going to effect, I believe, this November. So welcome back, Josh. Please go ahead.
Great. Thank you, Carrie. And good afternoon, everyone. It's always good to interact with the NASCSA membership. So looking forward today to kind of walking you through what NABP has been working on with Pulse, which is our digital platform that we're building to help facilitate communication between the state regulatory community and trading partners as you look ahead to implementation of the Drug Supply Chain Security Act and the electronic and interoperable system and what's supposed to be coming in November of this year. So I have a few slides that I'm going to work through before we jump into the demo, just to kind of give a level set for everything. So first, I think most on the call are probably familiar with NABP. We have shared membership across NABP and NASCSA. We are the association that represents the state boards of pharmacy. Our primary mission is to assist our member boards as they work to protect the public, and we do that through providing different sorts of programs and services to them, as they carry out their daily responsibilities. Looking at the NASCSA timeline, and one of the misnomers, unfortunately, that we continue to hear even nearly 10 years after the NASCSA was enacted by Congress, is that there's a new law going into effect. And obviously, and I think this group knows, NASCSA has been a law that passed in November of 2013 and has had a staged implementation over the course of that 10-year period of time. One of the things that took effect immediately upon passage and enactment was that all state and federal serialization and pedigree laws were immediately preempted. So whether a state had their own sort of pedigree law or something called the normal distribution channel or normal distribution chain, all of those laws were preempted, and the NASCSA became the law of the land. There have been some other requirements that have gone into place over the course of the past several years. Last year, the FDA published their guidelines for state licensing of wholesale distributors and third-party logistics providers. There was a comment period for that, and many states actually commented on those proposed rules. And now the FDA is reviewing the comments to the proposed rules and will eventually at some stage publish a final rule, or may publish an amended proposed rule, depending on what their review of the comments tells them. Now, the other piece with NASCSA that has gone into effect over the course of the past several years are certain requirements on trading partners within the supply chain. So one of the major ones was that wholesalers and 3PLs had to start reporting their licensing into this database that the FDA maintains. And so essentially they would have to report the licensing information at least once per year. The other requirement is that members of the supply chain, they're referred to as trading partners in the law, can only do business with other authorized trading partners. So that means that if you're a pharmacy and you want to do business with a wholesale distributor or third-party logistics provider, you can only do business with ones that are authorized under the NASCSA. So to be authorized as a wholesaler, that means you have to be licensed by the state. And then you also have to report into that database that I just referred to. Those are the two things that would trigger you being a wholesaler, being an authorized trading partner under NASCSA. So pharmacies, wholesalers, 3PLs, and other trading partners should already have processes in place to ensure that they're only doing business with authorized trading partners, or ATPs as they're referred to shorthand. The other thing that's gone into effect is you've seen manufacturers actually serializing products with those 2D barcodes. And so that's really what enables the tracking and tracing to occur as we look ahead to November and what's coming with the electronic and interoperable system. So that gets down to the saleable unit, actually applying that 2D barcode to the saleable unit of the product. And then finally, the other key thing that the DSCSA does is it also requires that either a trading partner or a regulator, as part of conducting an investigation into a suspect or illegitimate product, they have these tools called product verification and product tracing. Product verification comes in when you would scan the 2D barcode of a product, and then it would actually ask the manufacturer, send the manufacturer an electronic message to see, did the manufacturer affix this lot number, serial number, expiration date, and G10/NDC to that product. And then you get an affirmative yes or no back from the manufacturer. So again, trying to determine whether that serialized information was actually affixed to that product by the manufacturer. But ultimately, this all leads up to the electronic and interoperable system, that tracing down to the unit level, down to the package level for each trading partner, with full implementation anticipated for November of this year. Now, here's just kind of a high level of what the supply chain looks like, or would look like, as we move toward this electronic and interoperable system. So you can see how, you have the movement of the physical product. So the product moving from the manufacturer to the distributor. But what comes into play in November and is actually being implemented, at some level now, is that the transaction information is actually supposed to move in an electronic and interoperable manner in between trading partners. Now, today, how that information moves is you will recall the concept of the 3 keys: the transaction information, transaction history, and transaction statement. That actually today physically moves with the physical movement of product. Now, what is coming into play in November is that the requirement to actually pass that transaction history and build on that transaction history, which shows who previously owned the product, that requirement actually sunsets on November 27th of 2023. So what that means is that then there will no longer be a way for a regulator to inspect a pharmacy and to ask for the transaction history and know who actually owned that product previously. That means there would have to be a mechanism for them to actually rebuild that breadcrumb trail for who previously owned that product. And so that's really one of the issues that NABP has sought out to try to help solve is, could we build a mechanism or a system that would help, rebuild that transaction history, since it's no longer going to be with the product, at the dispenser wholesaler level. So one of our first steps, to start working on this was really, first we worked with our members to try to understand from our member boards, where are you relative to DSCSA? What keeps you up at night? What are you thinking about, as we look ahead to November? And then we convened a pilot where we pulled together state regulators, large and small manufacturers, distributors, and pharmacies, and tried to actually simulate what it would look like if NABP were to build a system that would create a tool that would allow a regulator to trace the prior ownership history of a suspect or illegitimate product. Now, we should say there are very specific things within the DSCSA, or very specific instances within the DSCSA, that allow a regulator to actually initiate a trace. It's if there's a product that they're investigating that is suspect, a product that they're investigating that is actually illegitimate, meaning you have credible evidence that there is something wrong with this product, whether it's counterfeit, something is discolored, or maybe it's diverted. So those are two of the primary instances where a regulator can actually request information, can request that tracing information in accordance with the DSCSA. And so what we actually simulated was those suspect and illegitimate product investigations or transactions. So we would, pretend that a regulator was making a request of a trading partner, and using email and spreadsheets, we would actually exchange information. And it was a really, as manual as that process was, what it led us to was really what's carried us forward since the first quarter of 2022. And that's that, there's really still some work to be done around the data exchange methods for tracing, that it's going to be important for regulators to also have the ability to initiate product verifications, which, as I mentioned, that's that scan of the 2D barcode that asks the manufacturer if these data elements were actually applied to that product by the manufacturer. And then finally, the need was very clear that there was a digital directory for the entire prescription drug supply chain. And why that becomes important is, it's okay to build a tool that facilitates tracing and to put technology around that. But if you don't have the phone book to look up where to actually send the request, that's when it breaks down. And so that was one of the main things that came out of our pilot effort, was the need for us to establish that digital directory. We published a pilot report that's available on our website, and you're welcome to go check out those details if you're interested. So then finally, this just gives an overview of kind of who all has been involved throughout this process. So you can see we have had, large and small, manufacturers, distributors, and dispensers. We've had a lot of representatives from the solution provider community that are providing NASCSA services to different trading partners. And then we've had great representation from the state boards of pharmacy. And so actually this month, we're wrapping up a second pilot that we've conducted where we've actually been utilizing the tool that I'm going to show you in a few minutes to initiate traces and exchange exchange test transaction information to, again, further tease out how this system should look and how it should function. And so then as we move forward, this just gives you an idea of the steps that we've been taking and how long this journey to Pulse has been. It really started with us back in August of 2021 when our executive committee, approved us to go forward with this exploration. We've already talked about the pilot that we conducted in early 2022, publishing our pilot. And then last fall, we did a proof of concept where we were, again, kind of prototyping what something might look like. Then in March of this year, we announced Pulse by NABP, which is the digital platform that we're launching. And then we're still, as I mentioned, conducting that tracing pilot to, again, gather additional business requirements and details for how the system should look and should function. And then Pulse, we're actually, starting our onboarding and beginning to bring trading partners into Pulse this month. And so this just gives another idea of, how information, would work underneath, within Pulse and within the solution. You would have a regulator that's logging in, making a request for information, and then getting the transaction information back from the trading partner. So instead of showing you pictures, I'm next just going to actually show you that we have this sandbox where we've been conducting the tracing pilot and working through these various scenarios. So I'm going to actually log into the sandbox and show you what it would be like for a regulator to initiate a product trace, and then for a trading partner to receive that request and provide a response back. Screens here. And so as you can see, we have a regulator that's logging in to Pulse. The thought process here is that the regulator would have the ability to, when they were out, in the field conducting an inspection, this is a solution that you will actually be able to use on your smartphone. So you would be able to log in on your phone or other tablet or device. And then as you're out in the field, if you identify a product that's suspect illegitimate, or if you find something that's diverted, you can actually scan the 2D barcode of that product. And what that scan will allow you to do is to begin to initiate the process of submitting a product trace, and then also identifying who the right trading partners are to actually send the trace to. So we have some dummy product scans that we've pulled in here to Pulse. And so what you can see is we have this mock capsule scan. We've got a G10. The serial number is just our identifier for the test, and then the date that we scan the product. So we're going to click on the scan, and what it propagates here is the actual information that you get from scanning the 2D barcode. But what's critical is that these are also the data elements that are needed in order for the trading partner to go search for the transaction information for this particular product. So you can see we've got the serial number, you've got the product's G10 and the NDC, so that tells you what the product is. You've got the lot number for the product, and then also the expiration date for the product. So these are the data elements here between serial number, G10 and NDC, lot, and expiration that you'll get from that 2D barcode, and that's what will enable the trading partner to actually initiate and find the transaction information for what you send them. So we're going to submit a new trace request. And so as I mentioned before, in accordance with the NASCSA, there are a limited number of reasons that a regulator can actually request transaction information under the NASCSA. And so in this instance, we're going to say, that we looked at this package, and this package here is discolored, or it's different from what we've normally seen. So we're going to say that that's suspect. We need to actually go and trace that ownership history to kind of understand who's owned that product previously, as one part of an investigation into a suspect product. So we're going to say it's this colored package. And obviously, if there's more information that you can provide, probably the more information, the better, especially when you're trying to provide information in detail to a manufacturer or other trading partner to return, to be able to want to return that transaction information to you. So now getting into the product information, as I mentioned, you've got the lot number, the product serial number, the G10, the NDC number, and the expiration date for the product. We would also have the ability that if you found just a few of these data elements on the product and you wanted to search for it, you would be able to do that as well. And because we've already scanned the 2D barcode of the product, we can automatically import the manufacturer. So essentially what we're doing here is building up our trace request. And we've done that by pulling in the product information, providing the details about the nature of the request, and then importing the manufacturer because we've done that scan. So now we're going to use the digital directory component of Pulse to search the trading partner directory to identify the next trading partner that we would want to send this request to. So in this example, let's say that we're out in the field, we're conducting an inspection, we see this product in a pharmacy as we're conducting the inspection. So we've scanned the 2D barcode, and so we know that this product is here in this pharmacy, but what we don't yet have is the information on who this pharmacy purchased the product from, and being able to, again, rebuild that breadcrumb trail. So we're going to search for our dummy DEF pharmacy that we found. So we pulled up the right pharmacy. We're going to click on the pharmacy to add. And so now what we're doing effectively is we are submitting this trace request to the manufacturer of the product. And we're asking the manufacturer of the product who they sold the product to. And then we're asking the pharmacy who they bought the product from. And so perhaps it was a direct transaction where it was going direct from manufacturer to pharmacy, or maybe there was a wholesaler or multiple wholesalers in between. But this at least allows us to initiate the product trace and to start sort of the first step in this investigation into this suspect product. So from here, we're going to submit the request. And we can see here in our active investigations, we've got a record of when we actually sent that request. And so now what we're going to do is we are going to log in and to see what it would look like if the pharmacy received this product trace request. And so the way that Pulse is going to be configured is that, again, it's a digital directory for the entire supply chain. But what we're doing as we're onboarding is we're also prompting the trading partners to provide us with who is the right person within your organization to send these trace requests to. Who is the NASCSA contact? Who is the right person that this information should be directed to. So that way you're not just sending it to some general inbox. So once the regulator submits that trace, we're going to notify within the platform itself, but then we're also going to send an email notification. So that way the trading partner knows that there's something for them to review within Pulse. So then the dispenser will be able to come in and look for their active requests. So here we have one that it's transaction information for this G10. We can see when it was submitted. So we're going to click into this. And now we can see the information about the requester. It came from a member of the State Board of Pharmacy. The State Board of Pharmacy inspector has said that this is a suspect product, that it's a discolored package. And then they've provided the necessary transaction information that I would need now as the dispenser to go search for this information and actually provide the transaction information back. Now, if say we get through the search and I identify that I actually don't have this transaction information, which would be a real problem if you had this product in your facility and you didn't have transaction information associated with it, that would put you in violation of the law. But in the event that you didn't, the dispenser would be able to provide a non-transaction response where there wasn't data, where you could say that there was no transaction information found, or maybe there's some follow-up questions that they need to ask. So there is the ability to actually submit a non-transaction response back. So that way, if there are additional follow-ups or other pieces of information that need to be provided back to the regulator, then the system would be able to do that. And so what we're going to do now is actually submit the transaction response. And there are a couple of different ways to do that within Pulse. So the first way is you could actually just add a transaction manually. And by adding a transaction manually, this gives you, some basic information where, basic fields to fill out where you could populate who the owner was. So this would be, this is who I bought the product from if I'm a pharmacy. So if I bought it from a wholesaler, if I bought it from the manufacturer, I would enter the owner of the product, the prior owner of the product here. And then I would identify myself, DEF Pharmacy, here in the owner to name. So again, just showing that change of ownership for the product. But then as you go further down, you've got all these other data elements to populate where there are a lot of ones and zeros and other characters to include. So what we would actually recommend, and what we do think will end up occurring, is that trading partners will either be able to pull this transaction information out of their NASCSA solution provider system, out of some sort of extract or download, or some pharmacies may be using their wholesaler to store their transaction information. So maybe the wholesaler will be able to, provide a portal to search for this information and pull the information down. So we're going to assume that this pharmacy has an extract either from their solution provider or from their wholesaler. And so they've gotten a particular format that they've been able to extract for the transaction information for this particular product. So let's open that up, and then we're going to click into this, and we can see here we've got the date for the transaction now. We can see that the first owner, the owner of the product, the entity that sold the product to the pharmacy, was GHI Distribution. And we can see that here they sold it to DEF Pharmacy. We now have the transaction date that it occurred. And then we have the other information that is, relevant to the request. So this is how that information ends up getting matched up. So that way the trading partner knows that they're providing information back on the correct transaction. And so we are going to then select this transaction because we feel good about this information here. And then we're going to submit the selected transaction. And now, as a dispenser, I now have a record of providing my response back to the regulator and within the period of time that you're supposed to do so under the law. And dispensers, they actually have to respond to requests from regulators or other trading partners within 2 business days. It is a different response period of time for manufacturers and distributors. They have to respond within 24 hours. So now we've shown what the response looks like, coming into the pharmacy, and the pharmacy has now told the regulator, I bought this product from GHI Distribution. So what we're going to do next is we're going to log out as the pharmacy, and now we're coming back in as if we're the regulator. So for the regulator, we can log in, and we're going to go into our current investigations. And what we're going to see is that we have a response that's come back here from one of the trading partners. So we're going to click into the actual investigation. And so we can see that here's the request that went to ABC Pharmaceuticals. We haven't received a response back from that yet. And here's the request that went to DEF Pharmacy. And we can see, yes, we do have a response back from that. And we can click in and see the further detail that shows when the transaction occurred, who sold the product to DEF Pharmacy. And so what we can do at this point now is actually initiate the next request in the process. So we can come right back into the response that we received from DEF Pharmacy, and then we can ask the same question of GHI distribution. So we're going to go here, search the directory for GHI distribution, and then we're going to add them to the trace. So again, we're going to say that this product is suspect. We're going to say that it's discolored. Make sure I get my spelling right here. And then we're ready to submit the trace request. So again, we're still waiting on the response back from the manufacturer, but now based on what we've received from the pharmacy, we can initiate that next request in the process and sending that to the distributor. So now we're logging in as if we're the distributor. So we've received a request for we've received an email notification letting us know that there is a trace request that's come in from a regulator. We will go in, log into Pulse, get into the transaction information, and we can see that here again, we've got this request for transaction information. We've got the details that we need to be able to provide that response back, to go search for the transaction information and provide the response back. And so here, we're going to actually upload the file. And this file, it does something a little bit different than what it did with the dispensers. It actually has two transactions. And the reason that it has two transactions listed is because the distributor not only has to provide the record of who they sold the product to, they also have to provide their information for who they bought the product from. So here's the first transaction, and it shows that the distributor bought the product from ABC Pharmaceuticals. It gives the transaction date, and then again, the other necessary information. So we're going to save this. And then we can come back up here. We can come back up here and actually get rid of that first. So we've got the ABC Pharmaceuticals there. So we can save that transaction. And actually, it looks like I accidentally uploaded the wrong file. So now we can come in and look at, and we can see now we've got GHI distribution in that transaction showing that GHI sold the product to DEF. We've already seen the transaction from ABC selling the product to the wholesaler. So at this point, we can select both of these transactions and submit the response back. So you can see both of these transactions are documented here, both for the sale from ABC to GHI and from the sale from GHI to DEF. So we're going to once again log out. We're going to come back in as the regulator. And then the regulator will be able to see that they now have the three requests that they've made to the manufacturer, to the pharmacy, and now to the distributor. We can see the initial request and then the two different types of transaction information, the two different transactions that came back, the sale from ABC to GHI, and then the sale from GHI to DEF. Now, the process will work largely the same for what we would show if I were showing the manufacturer responding. There's no real difference in that. So I'll save that just in the interest of, answering questions. But ultimately, this is this is what we've been working on and working through over the course of the past several months and have been utilizing for the tracing pilot that I referenced earlier. So with that, I am going to stop sharing here and head back to the presentation. And so when we think about what we're ultimately trying to accomplish with this work we've been doing over the course of the past couple of years, first and foremost, our goal is to make sure that we're equipping the states with the tools and resources they need to carry out their regulatory responsibilities. And by states, I mean not just the boards of pharmacy, I mean all of the entities that have regulatory responsibility for the prescription drug supply chain. So if it's, if your board doesn't regulate wholesalers and 3PLs within your state, this is a platform that we would offer and make available to those regulatory entities, just like we would our members, and we would also make it available at no cost. Another thing that we've learned throughout the process, though, is that when we think about the tools of tracing and verification, and these are the tools that NASCSA affords not only regulators, but trading partners to conduct their own investigations. It's really important that the small dispenser community has access to these tools as well. Because frankly, and I think I'm preaching to the choir here, it's the small dispenser community that is often targeted by counterfeiters and criminals with those, offers that are too good to be true. And it's because they are too good to be true. And so, you think about the tools that we're showing here and the tools that are provided under NASCSA. We want to provide these same tracing and verification tools to the dispenser community at no cost. We think that it is so important that we have widespread participation in this electronic and interoperable system of systems. So we want to be able to, make these tools available, because the reality is that many small pharmacies may not be able to afford a solution provider. So if they're relying on their wholesaler to store their transaction information for them, then our thought process is they can use Pulse as a tool to be able to initiate their own tracing and verification request, but then also respond to a trace request if they receive one of those from a regulator. And then, finally, we're working very hard to make sure the system we build is secure. Transaction information is considered to be confidential information, proprietary information. So we need to make sure that it's very secure and that only authorized individuals are requesting and getting access to it, and that the requests are being made in an appropriate manner. And then finally, and I think one of the things that's carried us forward through all this and really carries us forward, with everything we do, we're building this, we're providing this, and we're providing it at no cost because we think it's something and a tool that can help protect the public and help protect the prescription drug supply chain. And that's that's what NABP does, and that's what we focus on in the work we do every day. So what's ahead? So again, as I mentioned, Pulse is, we're beginning our sort of initial onboarding this month, and then we'll be sending additional information, out to other members of the supply chain to come in and to claim their Pulse profile, which there's no cost associated with that. And so that process is going to be carrying on. We're providing different educational webinars and materials, and if you're interested in getting signed up, visit pulse.pharmacy, and you'll be able to click on a link in there that will allow you to sign up to stay up to date on what's going on. We're also hosting an interoperability summit August 2nd and 3rd. We're hosting this with member boards of pharmacy, manufacturers, distributors, and other members of the supply chain, as well as the dispenser community, all focused on just what we can continue to do to carry forward the collaboration that that started back in January of 2022, when we started to get the supply chain and the regulatory community together. And then here's some useful links, and I will make sure to provide this deck to staff so that they can distribute this out. But there are some links to, a demonstration of this interoperability network, our tracing pilot report, some other blogs and articles that we've done over the course of time, and then also the link to Pulse.Pharmacy, and then also GS1. And it bears mentioning, GS1 is the global standards organization that is referenced a lot in how the transaction formats and how the data that moves between trading partners should be formatted. And there's an identifier called a global location number that's going to be particularly important for members of the supply chain, and in particular the pharmacy community to have that global location number. So that's something that we provide that link there as well. And with that, I think we've got plenty of time here for questions. But again, I would just like to thank NASCSA for the opportunity. We're very, very excited about what we're building with Pulse. We're very excited to show this in production, in live operation. What you've seen here is the prototype and the sandbox we've been working with. So we've been making even more improvements for what we're going to make available. I guess the last point I would make before we open it up for questions is regulator access. So we're going to be doing regulator onboarding into Pulse in the early fall period of time. Our focus initially is just getting the trading partners further in to the directory, getting them into Pulse. And then we're going to be, as we get closer to those tools, when those tools may be needed in November, that's when we'll be focusing on that regulator onboarding and more of the September into October timeframe, but still plenty of time to train and educate on how to use these tools and when the right time to use these tools actually is. So with that, I'm going to stop sharing and just open it up for questions. I'll turn it back to Carrie.
Thanks, Josh. Very good information. I have a question before go ahead and feed your questions into the chat or the Q&A. But so there are thousands of trading partners, right? And you said you were onboarding some of them through NABP, and then you'd be onboarding the regulators. Yep. But are all the pharmacies going to be uploaded? Or I mean, there are a lot of transaction requests that could come through this. So how do you know if the entity is in there?
Right. So, if you think about just what NABP knows about members of the supply chain today, right? We have our different accreditation programs, digital health, durable medical equipment, community pharmacy, and so on. We've got the drug distributor accreditation, another related program. So our estimation is that we already know a lot about roughly 56 to 57,000 trading partners. We know there are going to be some gaps in terms of, at least initially, what we don't know with the independent pharmacy community or perhaps some of the institutional pharmacies. So we're going to have a sort of different waves where we communicate, with a particular state or states to try to raise awareness that this is a tool and that it's a tool that costs them nothing and will enable them to meet their compliance obligations under DSCSA. So, by no means are we going to have everyone, by the time we start onboarding regulators, but I think it's an opportunity for us to work with the regulatory community to raise awareness about the fact that this tool does exist and that it's something that can help simplify some of the compliance obligations.
Okay, great. Thank you. Kathy, do we have questions in the chat?
So actually, there's a couple of them, and then I also have my own question I'm going to ask because you sort of alluded to the fact, and again, thank you NABP and thank you Josh for all of the work that NABP has been doing and for doing the webinar today. But Carrie alluded to the fact that there have potentially been some efforts to push back the date. And so I'd like you to talk a little bit about that as to, what the reality is. Is it NABP supportive of those efforts? Not so much, just to level set for people that are participating.
No, absolutely. And I'm glad you asked that. question whether I should have included that in the demo. So let's jump into that. So as we mentioned, this date has been looming out there for 10 years now, or we're down to 130 days, just in case, not that we're exactly counting how much time we have, but we're in this run up where we've got, 4 months and some change. And the reality is that each of the sectors of the supply chain are, even within the sectors, there are varying levels of readiness in terms of being able to just pass transaction information in an electronic and interoperable manner from one trading partner to another. So manufacturers should be passing that transaction information. Wholesalers should be ready to receive that transaction information and then pass it on to their downstream trading partners, whether it's another wholesaler or a dispenser. And the reality is that there are gaps within each sector. Why that becomes problematic is that if the FDA were to take a strict enforcement approach based on what is in the DSCSA, if they were to say that, we are enforcing this as the DSCSA was written, no enforcement discretion, no exceptions, otherwise what they can do within the law, that would have a significant impact on the movement of prescription drugs in the supply chain. For example, according to the law, if you have product, but you don't have transaction information associated with that product is deemed suspect, and you're not supposed to move that product into your inventory or further distribute that product. So that's one simple example of what a strict enforcement approach by FDA would look like. Now, stepping back, you have heard over the course of the past several weeks, or even going into last month, HDA submitted a letter to the FDA suggesting a phased implementation to DSCSA over the course of a 2-year period, where each of the sectors would have to be at particular milestones over the course of that 2-year period. Just this last week, APHA, NACDS, and NCPA submitted a letter that had a similar concept or a similar ask with some additional time. And I think they asked for 27 months. So moving into February of 2026, I think is what they were looking at. NABP is actually working on our own letter. And based on what we've learned over the course of, the past 2+ years, I think we've learned that, yes, there is a lot of variance and readiness within each of the sectors. And frankly, the concern that we have, and this was echoed in, the letter that came from the pharmacy organizations, as well as the letter that came, from HDA, our concern is on patients not being able to get their medications. And that is a bad public health outcome, regardless of what DSCSA is intending to do. It stands to make the drug shortage issues that we're having now much, much worse. So what we're working on right now, and what we're going to be sending to the FDA, is a letter that really highlights those concerns, highlights the concerns about the real need for clarity from the FDA, because frankly, it's the states that are going to be the ones that are regulating. You all are going to be the ones that are inspecting wholesalers and 3PLs and pharmacies. And so it's important for you all to have guidance on what is actually going to be enforced and what's not. Because the other thing that you don't want to have happen is to have a bunch of different approaches or thoughts on what you should actually be seeing at the pharmacy level. So our letter is going to come from that perspective on the need for some clarity around enforcement discretion and what that means. But then also we're coming up with a set of guidelines where we think manufacturers should be moving, distributors should be headed, and dispensers. So, not setting hard and fast milestones, but just saying these are things that need to keep moving in order to make progress, because there are parts of the supply chain that are just getting started on DSCSA, which is problematic. But the fear is that if there's enforcement, that everybody who just got started is going to stop. And the FDA doesn't want that, NABP doesn't want that, and certainly the others in the supply chain who've been working to get compliant don't want that either. So, we will be sending that letter, out here within the next couple of weeks, we expect, and we'll obviously distribute that out to our members, and we'll be sure to get that to NASCSA as well. So
if you mind, I can put that in our newsletter and post it on our website too, just as a FYI. And if you happen to have copies of the other letters, that would be, I think, valuable. I can actually put it in the email blast. The letter that you do have that has a copy of the recording too. So I want to just quickly go through a couple of the additional questions. I think you already touched on the first one, which was whether there was a fee for regulators to use Pulse. I think we answered that. My friend Theo from MD Scripts asked the question, is there an API for manufacturers, distributors, pharmacies to automatically respond to Pulse so that humans don't have to attend to requests for large numbers of traces?
Yes. So one of the things we've been doing with the tracing pilot that's kind of wrapping up this month and kind of the wave that we're in right now is actually working with the solution providers that provide DSCSA, DSCSA software. We're actually working on APIs with them right now, just to kind of test and see what that would look like, so that the request can go into whatever native system, a particular trading partner is using. What I would say is that the trading partners, and in particular at the distributor level and at the manufacturer level, when they receive a request from this transaction information for a suspect product, that is also going to trigger a number of other steps internally for them. So it's not like they're just going to say, oh, yep, here's this information, I'm going to provide it back. If it's a manufacturer, there's the potential that this is part of a major counterfeiting event. And so there will have to be, compliance involved and legal involved prior to providing some of those requests back. They still have to meet their obligation under the law, but it's not an immediate response like you would think about with a P&P report, for example. So there's a little bit of a difference there. But yes, we are working on APIs, and that'll be part of what we work on as we move toward launch.
Terrific. What is the file format of the trace files to be uploaded?
Yeah, so there's an organization, there are a couple of organizations that are standards organizations that we've been working very closely with. GS1 is one of them, and GS1 is coming up with a lot of the standards for communication between trading partners. One of the standards that still needs to be developed is on tracing, and so that's what the request looks like and what the response looks like. There's another standards organization in the same universe that works closely with GS1 and with NABP called the Partnership for DSCSA Governance. So they actually have a standard that we have been testing and implementing, within this tracing pilot that we've been doing. And so, yes, that JSON format is the file format that we've been testing with. And the data elements that we've been, that PDG has been providing is what we've been utilizing as we go forward. And just for background, PDG is a group comprised of representatives from the manufacturing, distribution, and pharmacy community. So it is an industry association that's focused on the standards and kind of helping move interoperability forward. And NABP is actually a member of PDG as well.
Okay. And follow-up and clarification, is the file to be uploaded the actual JSON formatted message that was transmitted between the trading partners?
So not exactly. So what is transmitted in between trading partners, that EPCIS file, that's one of the other standards and sort of alphabet soup we have in this space, that has a lot more information than what the required response is within the transaction history response. So, the larger file that's transmitted between trading partners has other details in terms of shipping information and other things that aren't going to be part of that standard trace response file. So I guess the answer to that is yes, partially.
Okay, I don't see any more questions. This was, but I think we'll still be hearing more about it. Time goes by.
And again, as I said, when it comes to what may or may not happen with enforcement, it's something that we're going to be watching very carefully. We'll be, definitely sharing that information out, and really trying to be really thoughtful on what enforcement means for the state regulatory community. Because as I mentioned, you all are the ones that are going to be out conducting the inspections and investigations. And so you all need to be equipped with, knowledge about what you should expect to see if there is enforcement. And how you can also help educate some of the dispensers and distributors that may not know what they need to be doing, being able to help move them along. Those are all things that help secure the supply chain as well.
Terrific. Okay, Carrie, I think we're ready to wrap it up.
Well, thank you, Josh and NABP. A lot of great information, a lot of great work has been done. I agree, this is, we may not all be ready for this. So working hard to do that. I may be asking to steal more slides from you. I know I've stolen a few for presentations in the past, Josh. So I do appreciate you very much. So it's really been fantastic. Obviously, if there are further questions that come up, NASCSA membership can get those to Kathy or myself, and we can get them to Josh. So once again, thanks to our speaker, Josh Bolin. Thanks, Kathy. This has been an excellent education for NASCSA membership. And on behalf of the National Association of State-Controlled Substance Authorities, we'd like to thank everyone who joined us for today's webinar, and thanks to our sponsors. We wish you a wonderful rest of your day.
Thank you.